Hi, everyone. Thank you for joining us for our webinar. We are going to get started in about 6 minutes. And everyone is on mute. Thank you for joining us. And we'll get started in about 5 minutes now. Thanks for joining us.
Hey there.
Hey, Mary, can you hear me?
I can. Can you hear me?
Yes.
Yay. And there's not, and my background noise is okay because I'm in an airport, but I'm in a very quiet place.
Yeah, no, it's good. And can you see the PowerPoint?
I can. I'm all set up. This is amazing.
Yeah.
Excellent. You just tell me when my slides start. You just give me an indication on the phone because I don't have the other one you sent with my slides. So there
Okay,
you go.
no problem. I'll hand it over to you. All right.
All right. I'm going to mute until I come back on.
Okay, sounds good.
Okay. Hello? Is it Sade?
This is Darla. I'm going to go ahead and get started. Hello, everyone. Welcome to the National Network for Youth and Child Focuses webinar on our publication that we recently released called Family First Prevention Services Act, Implications for Addressing Youth Homelessness. We will spend about an hour together, but we are gonna preserve plenty of time at the end for Q&A. So if you could please type your questions in the chat box. It's at the very, very bottom. And if you could make sure you type your questions to the entire audience. And then we'll just type your questions in as we go through. And then we'll try really hard to get through everybody's questions at the end. Hopefully everybody can see my screen. So also we are recording this webinar, and an archive of this webinar is going to be available on the National Network for Youth website. And hopefully everybody is fairly familiar with how to use GoToWebinar. Like I said, you all are on mute. And please type questions in the chat box. A lot of people type questions in the questions box, but it's harder to see. Anyhow, so our presenters today are myself. My name's Darla Bardine. I'm the Executive Director of the National Network for Youth. We're an over 40-year-old nonpartisan public education and advocacy organization dedicated to the eradication of youth homelessness in America. And we do that through seeking systemic change through both policy and practice resources and increased funding in what works. And next, I would love you all to meet Sade Hamilton. Sade, would you like to introduce yourself, please? I think you're on mute, Sade. It says you're self-muted. There you go. Sade? All right, let's go to Mary. Mary, can you introduce yourself, please?
Sure. This is Mary Bissell, and I am a partner with Child Focus. We're a small consulting firm that works on policy and practice issues in the child welfare field, and obviously in close connection with runaway and homeless youth and youth who are involved in the juvenile justice system and other children and families. So happy to be here today.
Great. Thanks, Mary. Sade? Okay. Sade's having problems speaking. So you'll definitely hear from her later, and she'll introduce herself. So this is our agenda for today. So we've done personal introductions. I'll do a little bit more of an introduction. We're going to talk a little bit more high level around just the connection between youth homelessness and the child welfare system. Then we'll move to talk more specifically about the Family First Prevention Services Act and how we think it could be a tool to be leveraged to address youth homelessness, as well as some of the potential unintended consequences. Then next we'll shift to talk a bit about what are some of the insights from the field that Child Focus and the National Network for Youth learned in doing this project together. And then we're going to end with some pretty specific recommendations and also some higher level recommendations and some our thoughts on next steps. And then we will open it up for Q&A, and we will go through and try to answer all the questions that folks have submitted.
Hello?
Hey, Sade, please introduce yourself.
Okay, sorry everyone, I'm having technical difficulties, but I'm Sade Hamilton from Chicago, Illinois. I serve on the National Youth Advisory Council.
Thank you, Sade. So just a little introduction around kind of our pathway into this work. The National Network for Youth really works at a cross-sector, really takes a cross-sector approach and a cross-system approach to youth homelessness. So we work with the Department of Labor, the Department of Justice, we work with HUD, the U.S. Department of Housing and Urban Development, the Department of Education, and HHS as well, to really take a cross-sector, cross-system approach to youth homelessness. So we've really been wanting to shift our focus in an intense, targeted way to the child welfare system for a while now. And it's definitely an issue that's been highlighted by our service provider members, as well as the data, and then especially just the journeys of young leaders like Sade Hamilton, who we work with through our National Youth Advisory Council. And Mary at Child Focus, they've been a perfect partner for us to kind of start doing this work and to see how and in what ways Family First could be leveraged, but also what could we think about bigger picture, longer term in terms of systems change, which from our perspective includes both policy and practice. So that's just a little bit about what kind of led us to this point. So now we'll just go through some high level information about the connection between youth homelessness and the child welfare system. So we have data, we have information. We know that approximately 4.2 million youth and young adults experience homelessness in the US annually. And then we know that youth who have been involved in the child welfare system are at high risk of homelessness. And the involvement in child welfare system is not just limited to exiting the system. A lot of the conversation and focus has really been around exits from care. But we know from research that Chapin Hall has done that it's far beyond just exiting to homelessness or exiting with limited resources that later can lead to homelessness. It's being in contact with the child welfare system at some point throughout a young person's life. We also know that youth who have been involved in the juvenile justice system or the criminal justice system are more likely to experience homelessness. 19 to 40% of young people who experience homelessness in the US are also subjected to sex or labor trafficking. We also know that youth with less than a high school diploma, African American and Hispanic youth, LGBTQ youth, and unmarried parenting youth are also at a greater risk of experiencing homelessness, and that LGBTQ youth and youth who have been in foster care also experience higher rates of trafficking than their peers. So this is some higher level data. So more specific to youth homelessness and child welfare system. So we have here in the center a young person in the child welfare system. They may have a failed reunification, kinship, or guardianship placement that leads to homelessness. The young person may have been homeless with their parents before entering the child welfare system. A young person may run away from a foster care placement, whether that's a foster family or a group home. And then other young people age out of the system to homelessness, either right away or soon thereafter. And a common journey for a young person is a child experiences homelessness with their parents as part of family homelessness, which can be categorized as neglect, and or there's abuse. A young person may come into contact with a child welfare involvement, and again, they may age out or not, but then they do experience homelessness unaccompanied by a parent as either a minor or a young adult. And then they may encounter a runaway and homeless youth service provider. So now we're going to move on to the Family First Prevention Services Act and how it's a tool to be leveraged to address youth homelessness and potential unintended consequences. And I'm going to hand it over to Mary.
Great, thanks, Darla, and thanks to everybody who's attending this conference call. I want to preface these slides by just talking about, I think, an issue that everyone struggles with, whether we're talking about the child welfare system or we're talking about runaway homeless youth providers or the juvenile justice system. I think what we see on the practice and policy realm is that all of these young people are so interconnected. And the challenges that they face and the opportunities that they face are all, interconnected, but that systems don't always recognize that. And so, unfortunately, as you all well know, we have, very siloed systems, very siloed funding sources, and from a governance perspective, when we deal with these issues on the policy level, different committees of jurisdiction and different staff that work on these. So. Despite best efforts, it's sometimes hard to undo those silos, and that's particularly challenging too in the implementation of a law like Family First that was really focused on, the child welfare system writ large. That being said, though, I think that there are a lot of possibilities for the systems to use this legislation as an opportunity to connect, and we're going to talk about some of those today. But also keeping in mind that, federal policy is a very blunt instrument. So if you all have a question and think, well, why weren't runaway and homeless youth, thought of in this particular provision, chances are that this is not what the legislation was directed at. But that doesn't mean that we can't utilize, all of the opportunities in those bills to help these intersecting populations. I also want to mention, too, just before we get started, that as many of you might know, there is currently a Family First Transition Act that's pending in Congress. It has bipartisan support. It is very likely to be part of the Drug Pricing Act that is hopefully and likely to pass, if not before the end of this year, in the first quarter of next year. And obviously things can interfere with that. But one of the most important provisions of that bill is going to be $500 million to help states with implementation of Family First. And while it's focused on Family First, it is very broad in terms of what states can use their allocated funds for. So in terms of really bringing these two kind of systems and sets of providers together, it's possible that if Family First Transition Act passes, that there'll be a lot more opportunities to really implement and operationalize some of the strategies that we're going to talk about. All right, so in terms of our big picture goal to start to solve youth and young adult homelessness, what we all want for any child and any young person, no matter where no matter what door they go through, is that they're able to access the full range of services that they need when they need it. To either avoid homelessness altogether or to quickly exit homelessness when it does occur. And this is certainly the goal of the child welfare system as well. What we want is to be able to, hopefully, before a family faces a crisis that will result in a child welfare placement, that they get the services that they need when they need them. And so that's certainly kind of an overarching goal when we talk about these transitions. So there are two overarching goals of the Family First Prevention and Services Act, and they're really, you could divide the legislation broadly into two categories. One is to really look at preventing entry into foster care and the ways in which funding and services could be used to make sure that families and young people get the help that they need before a foster care placement is necessary. The second piece, which I think is the one that I think causes both the most concern, but also prevents many of the opportunities, is to reduce congregate care placements. And like the juvenile justice system in recent years, the child welfare system is struggling to figure out how to reduce residential care, especially when it's being used as a default instead of finding families for these children. So Family First, for the first time, is going to reduce the amount or eliminate federal funding for certain residential congregate care placements, and that aren't what we call qualified residential treatment programs, and really strives to change federal funding incentives so that children are, when they need to be placed in foster care, are placed first with families. There are a couple of the specific provisions in Family First that I think hold most relevance and promise to runaway and homeless youth. That is the prevention services dollars that we're going to talk about in a second, reduce congregate care placements, and then finally the Chafee program and an eligibility extension to the Chafee program, which helps older youth in foster care, but also will have relevance for those who have also been involved in the homelessness system. I'm just going to try to, there we go. I couldn't see the PowerPoint. Sorry about that. So as many of you know, the main source of federal funding for foster care is Title IV-E, named after Title IV-E of the Social Security Act. And many of the challenges with how to support reforms through federal funding in the child welfare system have to do with how federal IV-E funding can be spent. Traditionally, it's really been focused only on out-of-home placement. And so, as you can imagine, some of the incentives for the system can also be, just too narrowly focused on out-of-home placements that happen, instead of focusing on those services and supports that could be delivered to families before a crisis occurs. And so Family First is really significant in that for the first time, it allows states to claim federal IV-E dollars for a limited range of prevention services. Who's eligible for the money? So states, as you know, collect federal IV-E on behalf of eligible candidates. But in terms of this legislation, eligible populations would include children who are candidates for foster care, meaning that they're at imminent risk of being removed from their families. And that includes funding to support parents and kinship caregivers. There are several types of prevention service that qualify under the Act, and there are three main categories of those, which include mental health services, substance use treatment, and parenting skill-based education, which doesn't necessarily have to be in-home. It can also be provided in the community. But those are the three services that the federal bill is starting with, and we're hoping over time that those might be expanded. Also, in order to qualify for federal funds, services really need to meet certain evidentiary standards that are laid out in the new law. And the idea behind this is that federal dollars only be spent on services that work. This is also a challenging part of the legislation, though, because I don't know if this is, I don't have the same knowledge of the runaway and homeless field, but the body of evidence-based practices are somewhat limited in the child welfare field. So trying to get a pipeline of services that are tested and these qualifications is going to be one of the big challenges in really ramping up this bill. Right now, what the bill says is that 50% of the prevention funds have to be spent on the highest level of evidentiary base, which is well-supported services. And in order to do that, the Family First Evidence-Based Clearinghouse has been tasked with rating eligible prevention services and has produced and is in the process of rating other programs to see if those intervention services meet the prevention criteria. Just a reminder too that Title IV-E is considered to be the payer of last resort. And so can't be used, including the prevention services, for services that are already funded through another funding stream, like Medicaid, for example. So in order to start drawing down the money, states have to submit a Family First Prevention Plan and are eligible for claiming prevention services beginning October 2019. And Utah was just the first state that was approved for its prevention plan. So congratulations on that front. In terms of implications for youth experiencing or at risk of homelessness, there's a lot of overlap and possibilities for the ways in which the prevention services funding might be helpful for youth who are experiencing homelessness or runaway. By defining youth experiencing homelessness and at risk of homelessness as candidates for foster care, states might be able to use prevention funding. But I do think that, as we talked about before, RHY providers are concerned about the lack of evidence-based and evidence-informed services for the population that might qualify for reimbursement. So one of our joint, I think, missions together in terms of these two fields is to make sure that we are both identifying all of the possible interventions that are already used, making sure that they're evaluated promptly by the evidence-based clearinghouse, and also, jointly seeking funding from other foundations like the Arnold Foundation, for example, to have these interventions tested so that they can qualify for these fundings. But obviously, in particular, the substance use services and I think, as well, the mental health services might be helpful to children who are in families and are experiencing homelessness at this time. I talked about before, the congregate care provisions are also very daunting for states, especially those that have become more dependent than others on congregate care placements. And, the intent of the bill was a good one, which is to, disallow federal funding for kids who are placed in residential care just because it's a default from the child welfare perspective. But they're without a clinical diagnosis that really warrants placement in this higher level of care. So the specifics of this provision are that placements lasting longer than 14 days and that don't meet a clinical need will no longer be eligible for 4E funding unless they qualify as qualified residential treatment programs. Those qualified residential treatment programs, which are going to be defined at the state level based on the federal legislation, have to comply with new standards in order to be eligible for Title 4E. And the standards include accreditation by a national accreditation body, the availability of trauma-informed treatment approaches, access to aftercare services, and other standards outlined in the law, which include working more regularly and intensely with families to make sure that once youth leave a residential setting, that they can transition more smoothly back into their families and communities. Under the new law, residential treatment, in order to receive federal reimbursement, at least, obviously residential treatment can still be paid for, that doesn't qualify under the federal law, can still be paid for under state funds. But in order to receive federal reimbursement, residential treatment placements can't last longer than 1 year. And courts are being asked to provide much stronger oversights on the case to determine the appropriateness of a higher level of care. The provision and the residential provisions in Family First have a couple of exceptions for two categories of young people, many of whom might also be experiencing homelessness. And those include those who are at risk of or experiencing sexual exploitation and pregnant and parenting youth in foster care. Supervised independent living programs are not subject to the congregate care restrictions described above, and all states have to begin complying with the congregate care provisions beginning October 1st, 2021. In terms of the congregate care piece, I think one of the things that states are struggling with, again, those states particularly who have been more reliant on residential care, is that they are busy, they're going to lose potentially some of this funding for some of their placements, but they are busily trying to figure out how to place more children in appropriate family settings, including recruiting foster families, supporting foster families that already exist, providing more kinship care supports, and a variety of other strategies. So in some senses, there has been a critique by some that that the bridge has been eliminated before the highway is complete. And I think that those concerns are also relevant to youth who might be experiencing homelessness or who might be running away from the foster care system. And in particular, the questions remain about alternatives to shelter stays for youth who leave home, who leave these congregate care placements, or family foster care kinship placements. So some stakeholders really expressed concern when we interviewed them that the exception for children at risk of sexual exploitation is too broad, so that you could potentially argue that any child who is in foster care is at risk of sexual exploitation, and therefore the racial provisions would be substantially weakened. I think that as we start to look at the state plans that many of the states have begun to share, that is not as much of a concern as we thought it was going to be, but it's still something that we're following carefully. The other concern I think that was shared in our interviews is that without adequate family reunification and support services or a robust pool of appropriate foster family homes, that more young people might disrupt or run away following their transitions from group care. So if proper supports aren't put in place so that a child can return to a kinship situation or a family foster home and isn't getting community-based services that they need to really make that placement work, or to make the reunification with their family of origin work, that it might increase the number of children who run away. And I think that, we talked about how Family First might be a pivot point for other, for other strategies where these two systems and these two groups of providers can work together. This is a big piece of that. To really work together to find a full continuum of supervised independent living programs and ensure there are enough services to meet the demand, and that the services that help kids step down from unnecessary residential placements are really there to prevent homelessness and runaway. The other piece of this that I think could be potentially relevant to service providers in the runaway and homeless youth arena is the CHAFE program eligibility extension. As many of you know, I think most of you are probably familiar with the CHAFE program that really focuses on the needs of older youth in foster care. And Family First amends the Title IV CHAFE program to allow services for youth up to age 23. The previous limit was 21. So our hope is that this extension into the category of older youth that are still at a very vulnerable and critical juncture in their lives is to help increase the support services and hopefully in some cases improve stability to prevent youth experiencing homelessness or running away. And I think, Darla, we just talked about this. Great. So do you want me to continue into insights from the field, or?
I can do this, and then if you can do recommendations.
Perfect. Let's do it.
Perfect.
Go for it.
We love working together. So child focus, sorry, let me advance the slide. So child focus in the National Network for Youth, our teams conducted more than 25 individual interviews with youth service providers, child welfare leaders, researchers, and policy experts. And we spent at least an hour with everybody, some longer than others. And it really helped us gather a lot of insights around part of some of it is what people were thinking about doing and what they had been working with their state to include in the plan. Others were again around potential opportunities of maybe what could happen if we had more funding or more federal guidance and leadership. And then other were just around kind of general concerns, we can do more. So we really tried to kind of summarize and synthesize the different insights that we gleaned from everyone. So the first, so a lot of the youth homelessness providers really pointed out that they are already and have been for decades providing services relevant to many of the issues addressed by Family First. So a lot of service providers are providing prevention services. They're providing services and interventions that prevent young people from entering the child welfare system. Also, child welfare systems and youth homelessness service providers do have very different orientations and do not always have a history of close and positive collaboration in many communities. So there were definitely concerns expressed around and an opportunity around building these partnerships, kind of building these bridges and using Family First to do that. And it could be potentially transformative if Family First was used in that way, but also really acknowledging that the child welfare system and youth homelessness service providers do have some challenges due to their different orientation. Additional insights is the law does have a narrow definition of evidence-based prevention services. So additional action and resources, similar to the law that Mary mentioned earlier with the $500 million, but also additional action and resources will be needed from states as well to meet the needs of children and families at risk of foster care placement and homelessness. And that many interviewees expressed hope that forthcoming federal guidance would interpret the law as broadly as possible in order to maximize its potential impact. And although Family First does not specifically focus on youth homelessness, several aspects of the law could address some common pathways to youth homelessness, including family conflict, group care placements that fail to meet the youth's needs, and a lack of transition planning for older youth in foster care. A lot of interviewees were interested in considering a strategy to explicitly include runaway and homeless youth as candidates for foster care in state prevention plans, but were equally concerned about unnecessary foster care system involvement and supervision in order to access these critical dollars. There was also a strong feeling that the law and current agency guidance does not adequately leverage some of the key opportunities, and a hope that this could be addressed through future federal action or by states and communities themselves. This was particularly true around prevention services. For example, interviewees wanted prevention supports to start further upstream, so more around primary prevention, and they saw opportunities for a broader range of services to be provided to candidates for foster care than was included. Also, Family First implementation planning was also seen as an opportunity to identify gaps in services and whether or not Family First funding can be used to fill those gaps. So a quote from one of the youth homelessness experts we interviewed said, "Well, I think this opens the door to prevention services. States still need to choose to walk through it." And that kind of refers back to the state plans that every state is required to write around implementing Families First Prevention Services Act. We included some examples of what some communities have been doing to increase coordination. We really strongly believe that better coordination does lead to better outcomes, though obviously coordinating across systems can be a challenge. So through the Youth Homeless Demonstration program grant in Nashville. They've developed a cross-system alternative response model for unaccompanied minors. And some of the key elements include that there's a single point of entry for young people experiencing homelessness. There's a common assessment approach to determine the best interventions. They provide case management and crisis resolution services. There's host homes designed to shelter young people that need an immediate place to stay. There's also case conferencing to help coordinate and assess needed services. And then we included another example, Project Minor Connect in Hennepin County, Minnesota. And this is again, it's a cross-sector approach, and it includes the Minnesota Department of Human Services, Hennepin County, and then youth service providers. And it was a pilot program designed for 15 to 17-year-olds at risk of or experiencing homelessness. And what the project provides is individual needs assessment, family group decision-making, youth and transition conferences, connections to different housing options, and when appropriate, family reunification supports. And then in King County, Seattle has a youth engagement team, which is a promising program that's really about helping youth experiencing homelessness navigate their involvement with multiple government systems. And again, this is a cross system work that includes runaway and homeless youth providers, child welfare, and juvenile justice system. It's coordinated by All Home, which is King County's homelessness coordinating body, and it seeks to tackle some of the root causes of youth homelessness, again, including conflict at home, a history of family homelessness, and legal barriers to stable housing. There's a holistic support team that includes a mental health counselor, a housing navigator, and a lawyer who work with each young person individually over a 6-month period. So those are some examples that we included in the paper. And one of the folks that we interviewed when talking about the congregate care and QRTS provision said, really believe strongly that young people should be able to receive the supports that they need for as long as necessary to move into self-sufficiency. So again, really preparing, an emphasis on really preparing young people for adulthood and for independent living. And now I want to turn it over to Sharday, but Sharday, are you on? Sharday's been having some technical difficulties.
Can you hear me?
Yes, go ahead.
Thank you. Whew. Okay. Hello, everyone. Again, it's me, Sharday, who serves on the National Youth Advisory Council. I've been on the council for about 4 years now. I just want to tell you some of the experiences that I have had with the juvenile justice system and the welfare system. I was a part of the system for 18 years of my life. Once I turned 18, I was pregnant with my daughter. In the midst of me being pregnant with my daughter, that's when I had experienced my homelessness because my mother had passed away. So when my mom passed away, I ended up staying in her abandoned home. While I was staying in an abandoned home, my daughter ended up getting involved with DCFS. So I had to deal with the system all over again. It definitely was. It is a hard fighting the system when you're homeless, when you don't have nobody to help, like a family member. I didn't have that type of resource, those help. It was just me. I didn't know that I had help out there. My caseworker never came out and seen me when I was in the system. So once I turned 18, it was already too late. I don't know if can they still hear me?
Yes, we can hear you.
Oh, okay. It keeps saying I'm muted. I'm sorry. But yeah, so I ended up my daughter ended up getting taken away from me. I had no help, no resources, no one to come let me know what to do. After 2 months, she was taken away from me. Her DCFS worker ended up letting me know that when I was turned 18, I qualified for college and school and stuff like that. But it was already too late for me because she was already involved in the system. If they would have known, if my caseworker would have stayed in contact with me, they could have provided me housing for me and my daughter. So I ended up having to go stay in the shelter for 9 months and stuff like that. So this family prevention first act is really helpful. It will really help out people who are in the child welfare system, with people who have children who are in the child welfare system who are going through homelessness. Okay.
Thank you, Sade. And you were ultimately helped and able to exit homelessness because of a runaway and homeless youth provider in Chicago.
Yes, I had went to a TLP who have provided me with a resource where I contacted the night ministry, which helped pregnant and parenting moms out. Due to the fact that I was pregnant with my son, if I was not pregnant with my son, I would not have been able to utilize their program. But due to the fact I was pregnant with my son, I was able to get housing, mental health. They helped me get my ID and things through their program.
Right.
Legal services and stuff.
And part of what we talk about in our publication, Sade, and part of what I know we work with you around is the importance of youth voice, and that any policy needs to have youth voice and impacted populations front and center. Is there anything you want to share around your experience with that, or your thoughts about why that is so important?
Oh, I love speaking on this topic.
Yes.
Youth voice is very necessary in order to make an impact. In order to get things going, you need someone who has experienced it, someone who has went through it. Like, a lot of people stand up for us, but it's not strong enough unless you have us there, like, stating our stories. When you know that we have lived through this, this is what we need. This is the resources we need to help us. And then that's why I like to do the work that I do on the council, because it's people out here who believe their voice won't get heard. So I go out and I'm the one who go in front of Ben Carson and talk to these legislators and these policy makers and let them know that we need help out here. Like, we need help, and we're the ones who need the help. So you should listen to us. We are the voice that need to be heard. Darla?
Sorry, I muted myself. Yes, Sade, I was cheering too. I was cheering. Thank you so much, Sade. All right, I'm going to hand it back over to Mary to go through the recommendations.
That sounds great. And Sade, thank you so much. I just so appreciate you sharing your experiences with everybody on this phone call. Webinars are really hard to do because you don't get, you don't know how any of your comments are being received, but it was just really meaningful to listen to you, and I just appreciate your feedback and your ongoing advocacy on these issues. And your children are adorable.
Yes.
Absolutely adorable. It's like a Baby Gap ad.
Yes.
All right, so I'm going to turn to the recommendations. As I said, I think as Darla, as our teams have been working together, and we have been, I think if you, all of the advocates who are on this call, all of the policy and program folks on this call have good relationships, or have some folks locally that they can really turn to when they need, access and insight into different systems. And it's no different than that on the federal level. Darla and her team and Child Focus and folks on the Hill have worked together for a really long time to try to make sure that, whatever door young people walk through, that they get the services that they need when they need them. And unfortunately, we don't always succeed at that, but that is really the intent. And so we see Family First as very similarly, which is that we want it to be a jumping off point to really not only talk about the opportunities for Family First, but also to talk about what still needs to be done in terms of better coordination among runaway and homeless youth providers and child welfare providers, and also those in other systems, folks who are serving pregnant and parenting youth, folks who are providing health care, reproductive health folks, people who are dealing with nutrition needs. This is really an opportunity to see what can we do now, how can we utilize funding both that come through the Family First Act and also through the Family First Transition Act if it passes, and we hope it will. But also, what are the gaps that still need to be made? So just a couple of things. And one of them sounds obvious, but I don't think it's always the case. Almost every state right now is actively involved in trying to figure out what their prevention and reduction of congregate care plans are going to be for the Family First Act. And it is imperative that youth homelessness service providers be a part of that implementation planning. And if you haven't been reached out to, it's important that you reach out to those folks in the child welfare system that you've had particularly good relationships with, and make sure that both youth homeless service providers and young people themselves are involved in these transition conversations. In terms of the next recommendation, I'm just going to minimize my screen so I can actually see the work. State child welfare agencies and homeless providers should also go beyond Family First to develop strategies that ensure that youth have a role in shaping the programming, that these populations are protected regardless of what the implementation plan would be, and that youth, and I think this is true across systems, are not placed too far from home and community, where they not only might not get the resources they need, but they also don't have the social supports and family friends and faith communities and other things that they've grown up with. Finally, policymakers and child welfare agencies and other partners really need to think about how to provide the full array of needed services available for child welfare involved youth and families, and how to pay for that, how to maybe look at blending of funding streams, maybe to try to develop a better understanding of how each communities and each provider community's funding streams work. Again, to make sure that services are delivered in a more seamless way. Sorry, I'm just going to wait until the announcement in the airport in which I'm sitting is done. Because we are on the move here at Child Focus. The other piece that we really want to look at is consistent with Family First focus on using evidence to drive action, is that we really want states and other stakeholders to use data to ensure that any of the progress that's made under Family First is achieving its goals, and course correct as needed. And so that's going to involve a commitment by both runaway and homeless youth providers and folks in the child welfare system to get a better handle on what the intersection of those two systems are, and whether the interventions that are being provided are really achieving the outcomes that they need to. We also heard a lot in our interviews from direct service professionals in both the child welfare and youth homelessness fields. And what they were saying was that often some of the decisions about how Family First is implemented and how some of these critical services are provided are that they might be left out of those particular decision-making processes, that sometimes the implementation decisions tend to go on at the policy level, at top leadership level, without really reaching out to the folks who are interacting with youth every day. So I think, it's how do we get as broad and as diverse a group involved and invested in the Family First implementation process as possible, so that young people really understand the full range of options and services that are available to them. There's also, and not to seem like Captain Obvious here, but there's also a huge continuing role for the federal government to play. And one of the amazing things about the Family First Act and the Family First Transition Act is that there is really impressive bipartisan, support of young people in foster care and runaway and homeless youth, but also cooperation between them. And so this is a group of folks from the Finance and Ways and Means Committee on both sides of the aisle that are very open to making sure that there are no populations that are left behind in legislation, and also doing their own legislative course correcting. So I want to do a shout out for the staffers that have been working so hard on this bill. I think that one of the things that we would summarize from our interviews is that the federal government also has a role to play in acting on the insights and recommendations by looking at ways to address primary prevention more directly. And I think this is something that is already being discussed, either in federal legislation or funding streams. So service providers can hop in and be funded to do so, even before the child is in imminent risk of being removed from their home. Obviously, increased funding is tough in this budget environment, but what we're seeing is that the current funding levels aren't necessarily getting all of the young people that need them. So increasing funding for states that choose to expand Chafee is going to be key, and to make sure that the full array of services is available. And then ensuring that interventions that work well for youth have runaway or have youth who have experienced having run away or experienced homelessness are included in the clearinghouse. We talked about that a little bit before, but that is essential. How do we get the interventions that are in the field now and they're really working evaluated so that they can access this imperative and critical federal funding? This is a chart that's also available in the final publication that we put out, but what it reminds us of is the many layers of folks who need to be invested in this act to make sure that it's implemented. And that even once the act is implemented, to see where gaps still lie that might be able to be addressed both on the policy and the program level. So obviously federal and state policymakers, we talked about that. Providers, not just leaders of local organizations, but the caseworkers and others who are working on the front lines. And most importantly, folks like Sharday who have lived experience in these issues and also have a much better understanding than anybody else of what the needs really are and how they should be provided. So not just young people, but other stakeholders as well from other systems, and also champions in the communities, educators, mentors and coaches and others. Again, I don't want to repeat myself too much, but I do, because we really see this as a chance to get the conversation started on a variety of fronts that will help child welfare and runaway and homeless youth communities better team up to help and provide more seamless services to youth experiencing homelessness and the child welfare system. I think, one of the things that we heard from our interviewees were the necessity to implement policy changes in a way that could really lead to a stronger safety net to prevent youth homelessness in the first place, which would include developing stronger practice models to address the holistic needs of young people and their families, implementing funding models that would help prevent youth homelessness, particularly for those who have already experienced child welfare involvement, and ensure that any prevention efforts are broad enough not just to focus on families who might be at risk of involvement in the foster care system, but who are, struggling with affordable housing and a whole range of other services that might subject them to homelessness and involvement in the child welfare system. I am going to turn it over to Darla for the questions, and I'm happy to participate in that, but just really, really want to thank you all for the opportunity both to work with Darla and her team on this and to present to all of you.
Great. Thank you so much, Mary. And also, Mary, you typed in quite a few answers to questions here. Very impressive. But yes, just to say to everybody, this PowerPoint and this recording of our webinar is going to be added you can go to the resources page on our website, the National Network for Youth, and you will be able to access it. I'm just going to ask the questions that Mary didn't have time to answer. Kita asks, what's the policy regarding former students that may be homeless now or could be a possible runaway, but they are no longer a student at your school and they continue to pop up on the runaway reports? I'm not sure if that young person is child welfare involved or not. But Mary, what would you say to Kita?
I didn't unmute myself. I'm really not sure how to answer this question, Kita. What I think, unless the child was involved in the foster care system, I'm assuming that like former students. So I don't know how to answer this question. And so what I'm going to do is get back to you. But I'm assuming, and maybe you could clarify this on the question, that you're talking about a student that's also been involved in the child welfare system.
Yeah, because that would definitely. And then Priscilla responded back to your answer, to your response to her. And she said she can understand she's on the side of children who are removed, but do wonder how does one even prevent a removal from happening unless something's already in place for those parents of the children, something that would have to be eliminating their having to be removed, like anger management, drug rehab, parental skills, family planning, things like that. Do you want to speak to that? Because I think it's kind of getting to the, yeah, go ahead.
Yeah, Priscilla, this is a great question. And I think that in terms of, exactly how the Family First Act is going to address these things is still yet to be seen, but I can tell you what the intent is. And the idea is that, states in the child welfare system aren't new to prevention. There are many programs that states and county level child welfare systems already have in place to prevent, to give families the supports that they need so that that the child doesn't need to be removed. The situation doesn't become so grave that the child has to be removed. So this isn't the first time that states are talking about prevention. It's really more about whether federal funding can support those prevention services. So the way that prevention programs really function now, and it varies from state to state, but the way that it functions now is that when parents, are first really starting to struggle, that they would be given, mental health counseling. If an issue like that, it would be substance abuse treatment, so that the child doesn't have to be removed. All of those things that you listed in your follow-up answer, just basic parenting skills, could be the stress of not having a job or having to find housing. How can those things be addressed so that that kind of pressure could be alleviated, and the family can kind of regain a measure of stability going forward? So all of these things are relevant, and a lot of those services are provided. What this bill does, it's really significant, is it allows for those services that have an evidence base, it allows states to draw down federal funding in a way that they haven't before. And I think what we're all looking to is how could that be expanded in the future so that it's kind of any range of services that families need in order to maintain, their stability and sense of unity. I hope that answers your question.
Yeah, and I think so. The next question we definitely get a lot. So this is again to you, Mary. Is the thought that emergency shelters will need to be accredited in addition to the residential treatment centers under the QRTP guidelines? I think the answer is yes, but if you could.
Yeah, so we don't, I mean, the answer actually is we actually don't know yet because the states are going to have to weigh in on that. And most states haven't released their QRTP guidelines yet, even those states who have already submitted a plan. So the answer to that question is stay tuned. we do not know.
Great. And the next, I think, final question is, will case management, mentoring, and parent education become more of the services that will become more vocal with the needs of the children and families? Will these services be suggested more?
So I think I just want to make sure that I understand the question. What you're saying is because there are three categories that are allowable in terms of reimbursement under the Family First Act, that like, will that incentivize these services to be offered more? And I think, in some ways that's a possibility, but also, again, as I said before, child welfare agencies are already providing a whole range of prevention services, and they fund them in different ways, either with state funding or with Title IV-B funding, which is another part of the Social Security Act that provides funding, or CAPTA funding, the Child Abuse Prevention and Treatment Act. And so I think, while there might be some incentive, there are still other funding sources that can be used for a broader variety of prevention services. So I'm not sure if these are going to become more prominent simply because they're listed as allowable services under the Act. But that will remain to be seen. I mean, certainly having an available federal funding source incentivizes activities. So it's always a possibility, and it's a good question.
Thank you so much, Mary. So before we go, and being mindful of time, I did want to let everybody know that the National Network for Youth's 7th Annual National Summit on Youth Homelessness will be March 2nd and 3rd in Washington, D.C. You can go to our website and you can register. Part of our summit does include an education track, and the content for that education track is developed and presented by Schoolhouse Connection and their partners on the ground. We also have an optional day that you can add on to your time in Washington, D.C., and you can earn a certificate on human trafficking from the National Network for Youth and the McCain Institute. Also, it's time to renew membership for 2020, or if you're not already a member, join us. You can join now and you get the rest of December free. How much it costs really depends on what type of organization you are. And if you're a school district, it's $200 a year and it applies to everybody at the school. If you're a community-based service provider, then the amount really ranges on the size of your budget, what your annual budget is, and it's anywhere from $350 a year to $2,000, again, depending on your organization's budget. I want to thank Mary and Sharday for joining us, sharing their expertise with you all, and I really want to thank all of you for joining us for this webinar, engaging in a conversation, and for all the work that each of you do every day on behalf of and in partnership with young people. Thank you.